pain doesn't always define disability. And there's a number of factors that really affect that. And that's why it has to be individualized to the person.
We have these joints that are where the bones touch each other. Similar to a knee joint or a hip joint, over time they start to wear together and they can also start to degenerate.
So these are some of the ways that we can help with chronic pain. Lifestyle modifications you do yourself. And you have to realize pain is multifactorial. There's a lot of things that influence your pain. So therefore we have to treat it with different modalities. Physical therapy, chiropractic, acupuncture, exercise, bracing, injection, and surgeries.
Having the most accurate diagnosis possible is going to set you up not only to have a better understanding of what you're dealing with, but also to have the best possible success moving forward with your treatments.
So you may have a nerve component to it, which may respond to something like muscular stimulation. There may be an inflammatory component that may respond to a steroid or something to that effect. So just like Rai said, I think we have to evaluate you, and sometimes with trial and error.